Hi, my name is Mike Johnson. Last month I had a part of my lung removed. When I was told I needed this operation, I was scared. I wondered what was going to happen in the hospital and when I got home. I wanted to do everything I could to be ready for my operation and back to a normal routine as quick as possible.
You've got a spot in your left upper lobe.
Of course, receiving a diagnosis of a lung condition is a difficult and sensitive moment in your life. It is for everyone. You're not alone.
I'm going to talk to you about some tests to make sure this hasn't spread anywhere.
There's always anxiety, you can't help it, but knowing what to expect is the most important thing.
This presentation was put together by a surgical team and patients. It will show you what to expect, how to prepare, and how to work with a surgical team to manage your care while in a hospital and at home. Learning and preparing for your operation as well as your home care will help you to have the best chance for a full recovery. So let's begin. Open up your lung surgery skill kit. Get a pen, have your booklet ready so we can write down any questions. Refer to the different forms in the kit. If you are watching this on your TV, have a remote control nearby so that you can pause the DVD to take time to practice the skills as we go through them. It's important to fill out your evaluation form. We need to hear from you to make sure we didn't miss anything.
It's helpful to understand a little about how your lungs work. So let's begin. When you take a breath, air and oxygen pass from your mouth and nose through your trachea and into your lungs. Your lungs carry the oxygen through small tubes called bronchioles, and then to the alveoli. The alveolus is where the oxygen meets with the bloodstream. Oxygen is provided to the blood and carbon dioxide is released back into the alveoli. As you breathe out, the carbon dioxide gas goes out through your lungs and then your mouth and nose. The lungs are divided into lobes. There are 3 lobes on your right side and 2 on your left. The lungs also have a large supply of lymph nodes. The lymph nodes are small, round masses of tissue that filter the blood and carry fluid and waste products through the lymphatic vessels. Most often, lung cancer is the reason that you need to have part of your lung removed. Lung cancer starts in the cells lining your lungs. Cancer cells grow faster and look abnormal in comparison to your healthy cells. The cancer cells also release chemicals that cause new blood vessels to form. The cells continue to grow and eventually can be seen as a tumor on imaging tests.
As we get down here, right here it is. Yeah.
The cancer cells can spread or metastasize to other parts of the lung and body. The stage of your cancer is determined by the size of the tumor and if there is spread to other areas. This includes nearby lymph nodes. The lymph nodes can be in your lungs and within your chest cavity between the lungs. The stages range from 1, where there are some abnormal cells lining the airway, to stage 4, where the tumors have spread throughout the body. Your doctor will develop a treatment plan based on your stage and other health considerations. Please refer to your booklet, which goes into more detail on each stage of cancer.
After examining you and your records, your surgeon will discuss the surgical approach that is most appropriate for you.
The type of procedure that you will need depends on the location and size of your tumor or to the extent of blockage or fluid around the lung. A wedge resection removes a small pie-shaped section of the lung. A segment resection removes a slightly larger section of the lung, but not an entire lobe. A lobectomy removes an entire lung lobe. The other lobes on that same side remain. When an entire lung lobe is removed, the rest of the lung hyperinflates to fill up the space. A pneumonectomy is a procedure that removes the entire lung on one side. This is rarely done.
Your surgeon would have discussed the surgical approach proposed for you prior to your surgery.
There's really two basic approaches. One approach is to perform what is called a thoracotomy. This involves an incision on your back or on your side. That's a classic incision. It involves cutting through the muscles that we use to breathe with, the chest wall muscles, and going between the ribs, but generally we have to spread or even remove a piece of rib so we can get access, direct access into the chest. The second approach is called video-assisted thoracic surgery, or VATS, and that involves making typically 3 half-inch incisions. They go between the ribs. They don't spread or affect the ribs or the nerves under the ribs. They don't cut the muscles on the chest wall, and that's why it has been a big advance over the last 10 or 20 years because it minimizes the pain and trauma to the patient.
Regardless of which of these techniques is right for you, there will also be incisions made near your ribs to accommodate tubes placed around your lung at the time of surgery. These tubes are to release any fluid or air that may build up immediately after the operation.
Before you have surgery, it is essential to follow certain steps. These steps ensure your procedure and recovery will be as successful as possible. For instance, you will need to have a preoperative assessment.
Sign in right here, and then we'll have a seat and she's going to call your name.
This is to ensure you are able to undergo surgery. Most likely, your surgeon will have arranged for advanced imaging studies, lung function tests, a cardiac stress test, as well as blood tests, and will have reviewed the results.
It takes a lot of time, just like we've seen today.
Then there's going to be a lot of downtime while you're waiting to get things done.
You have to have patience.
The tests help identify your current pulmonary or lung function, the extent of your tumor, and your overall state of health. A blood test, urinalysis, and chest X-ray are routine tests before your operation. If you have any heart condition or are over the age of 50, you may also need an electrocardiogram. A pulmonary function measures the amount of air that you breathe in and how much oxygen gets into your bloodstream. You usually don't eat or smoke for 4 to 6 hours before the test. Also, a heart ultrasound may be performed.
In terms of the cancer, we need to find out whether it's spread anywhere. That's called staging. We do that with a couple of tests. You've already had your CAT scan. This tells me that the spot's here in your left upper lobe. Now we're going to do a PET scan, which is a metabolic test. It'll tell me which cells in your body are metabolically active. I expect this spot in your upper lobe to light up. What I'd like to find out is if there are any lymph nodes here in the middle part of your chest that might be involved, and any sites outside your chest that might be involved.
A CT scan and possibly a PET whole body scan or MRI of the brain may be needed.
All these things are non-invasive. They just involve you holding still and letting us take some pictures. The next step we would get to is a trip to the operating room. First thing I'm going to do is look down the windpipe with a small scope. This scope would go down your windpipe and out into the lung and allow me to look at the anatomy of the lung. And occasionally I can get all the way out to this tumor and take some samples.
This clinic visit is also the time to start thinking about your postoperative care. He would come to the recovery room afterwards and be in there for an hour or two. After hospitalization for surgery, most patients are able to be discharged and return home within a few days. However, some patients have special needs. They may require additional rehabilitation after surgery and a longer stay in the hospital, or they may need assistance with therapy when they return home. At the time of your clinic visit, you may be identified as someone eligible to participate in research studies.
I'm with the thoracic research team here.
Participation in these trials may allow you access to newer experimental treatments. How can that help you or help other people? But we like to keep that tissue available to study that. You know, they'll never know that it's your tissue and so forth like that. But what that does, and you know, you don't have to be involved in that unless you want to. But a lot of people say, well, I don't need that tissue anymore, and I'm glad you to have it.
We just covered some of the preoperative tests and procedures. Now let's review what you can do at home. When possible, you should start preparing 3 to 5 weeks before your operation. Refer to your lung surgery booklet, including the sheets on the front cover.
absolutely stop smoking is probably one of the most important things.
The best thing you can do to make this surgical intervention safe is to quit smoking. Can you do that for me?
Yes. Okay. I'm starting some stages of it now.
Okay, well, there's lots of tools to help, and we can use combinations of those, but it starts with you.
Your breathing exercises are extremely important and will remain so throughout your hospitalization. You are to do them on a regular basis after your surgery and as you recuperate at home.
So this is the incentive spirometer. The first step is to just sit up straight in your chair. Okay. Great. And then you're going to exhale. Okay, so just breathe out like you normally would. Then you're going to take the incentive spirometer, you're going to put this in your mouth, close your lips around it, and breathe in deeply. Hold. Okay.
4 or 5 times every hour, you will take deep breaths to help expand your lungs. You may be also given a flutter valve. Blowing into this 4 or 5 times an hour will help you clear secretions. This device may make you cough to help clear mucus from your airways. Doing your breathing exercises is one way your participation is important in your recovery from surgery.
Before your operation, begin or continue with a daily exercise plan. Make sure this is okay with your doctor. Start by walking or riding a stationary bike. You want to exercise for 30 minutes each day. It's okay if you have to rest after 10 minutes or so. Just get up and go 2 more times later. While in the hospital, you will usually start walking the day after your operation.
After your operation, you might have some stiffness and pain. So I'm going to teach you some range of motion exercises. First of all, we're just going to teach you how to do some range of motion with your head and neck. You're going to go side to side, so put your ear almost to your shoulder. Great. Then this side. All right, wonderful. Lift your arms straight up and just go slow. And you're going to repeat that 5 to 6 times. Just take your hands and go and walk up the wall.
Some of your medications may have to be adjusted before your operation. Write down a list of all the medications and share this with your doctor. Your list should include medications that are prescribed by other doctors and even over-the-counter medications, such as aspirin, herbs, and vitamins. Refer to the booklet for a full list of medications.
No special changes in diet or exercise are required for the day before your surgery. This is a good day to take things easy and put yourself in the best frame of mind for your hospitalization. Have lunch with your family or friends. Go for a walk.
You gotta remember, you're not the first one to go through this. There's been hundreds of thousands of people to go through this. The most important thing is spending time with your family and just relaxing, taking it easy. Tonight, you probably won't get much sleep just because you're worrying about things. The best night to get sleep is last night.
Remember, being rested and free of stress can be very helpful for you and assist in your recovery.
On the day of your surgery, you will not eat or drink. You usually can take your morning medication with a sip of water, but check with your doctor first.
When you arrive at the hospital, you will report to the surgical registration and waiting room. In most cases, patients will receive a pre-admission packet from the clinic where they had their pre-admission assessment.
So they know exactly where to go, they have maps to know where they go and what to expect.
When you get to the hospital, an identification bracelet with your name and the hospital number will be placed on your wrist.
Can you tell me your name and date of birth?
Your ID should be checked by the healthcare team before providing any procedures or giving you medication. 10, 15, 55.
Okay, great.
If you have allergies, you will also get an allergy alert bracelet.
I'm just going to review what we plan to do today. After I finish, we're going to give you a little feel-good medicine, and the anesthesia team's going to put in the thoracic epidural so that when you wake up, you're nice and comfortable. I'm going to take this fancy magic marker, put a little X here, put my initials. So this is the general area where we're going to be working today.
Your surgical team will select a variety of options to help manage your pain. These include a patient-controlled epidural pump, a patient-controlled analgesia pump, and a local infusion pump.
Some patients may receive an epidural catheter for pain management after surgery. This is a small tube placed in your back that distributes numbing medication around the nerves to your chest. Your surgeon and anesthesiologist will determine if this is the best course of action for you.
This is a thoracic epidural catheter. It's put in the mid-thoracic spine. It's usually taped to the patient's shoulder on the opposite side from the incision, so we're nowhere near it with our surgery. And then it's connected to an infusion pump that gives a very small amount of a mixture of narcotic and local anesthetic that bathes the nerve roots that are supplying sensation to the area of the incision, so that your patient's nice and comfortable when he wakes up.
You may also have a PCA and an epidural, which are two pumps that we use for pain management. You need to use those. Don't be shy. Don't be afraid of overdosing, because they are smart pumps and you can't overdose.
So we have this reservoir here that's full of local anesthetic, okay? And I have a little button here that you can push if you're uncomfortable. It'll give you some extra pain medicine, all right? You understand that? Yes. Okay. That little pump is connected to a tiny catheter that we've tunneled right underneath the skin, down on the muscle layer right near your incision here. So it's going to bathe that incision in local anesthesia. So if you're uncomfortable, hit that button. You can't hurt yourself with this. It can only make you more comfortable.
On a 0 to 10 scale, how would you rate your pain? Because that's kind of how we track your pain level. 0 is really no pain, and 10 would be the most excruciating pain you could have. Where would you rate it?
Right now, probably 1 or 2.
Okay.
Most.
Okay.
You will usually be switched to oral pain medication the next day or so after your operation. You may also have some sore throat pain from the tube that was placed in your throat during the operation. Throat lozenges may help with your sore throat pain.
If at any time you have questions about these pre-surgery procedures or the surgery you are about to undergo, please feel free to ask any of the individuals involved in your care.
During the surgery, we do put a larger size tube in your throat to help you breathe during the surgery. So the risk of you having a sore throat from it is a little bit higher than normal surgery, okay?
At this point, you are now prepared for surgery. You will be taken to the operating room. Your family will be shown to the appropriate waiting room areas.
Well, think about a nice beach or someplace to relax, take a short nap. We'll take good care of it.
I sure will.
I'll see you in the recovery room.
All right, thank you, Doctor.
Here, your surgical team will again verify your name, type of surgery, and date of birth. EKG pads will be placed on your chest to assess your heart rate and rhythm. A probe will be put on your finger to monitor your oxygen rate. A soft mask will be placed over your mouth for fresh oxygen. At this point, you'll be given general anesthesia. Once you're asleep, a Foley catheter will be placed in your bladder for urine collection. The catheter may be inserted into an artery in your wrist to monitor your blood pressure. Naturally, your privacy is always respected, even when you are asleep. With preparations complete, your surgery can begin.
You can expect your surgery to take anywhere from 1 to 5 hours, depending on the complexity of the surgery. Your family will receive periodic updates on your condition throughout the procedure.
Immediately after your surgery, you will either go directly to the surgical intensive care unit or to the post-anesthesia care unit. It generally takes 2 to 3 hours before a patient kind of wakes up and feels good and is over the anesthesia. I know you're a little groggy. Everything went fine. Surgery went very well, okay? We got the tumors out completely. You will stay here for approximately 1 to 3 hours for close observation. You will then be transferred to your room.
Hi, Mike. It's Dr. DeCamp. You're in the recovery room. Everything went great.
Your surgical team will be closely monitoring your recovery and working with you to decrease the risks of possible complications. You will be hooked up to many wires and tubes. These include IV lines, chest tube, bladder catheter, oxygen and heart rate, and breathing monitoring.
Your surgeon or a member of his staff will speak with your family to update them on your condition.
So Mike's doing great. I just saw him in the recovery room. Everything went fine. We accomplished everything we needed to do.
After your surgery, you will likely be very sleepy and not remember much about the day. As soon as you're ready and you've been transferred from the post-anesthesia care unit, your family may visit you in your room.
Well, it's, you're obviously in some discomfort, but nothing that I didn't expect.
That first day, the changes hour by hour are quite dramatic.
And you slowly seem to recover, you just get stronger and stronger. I'm tired. I'm really tired. So, I mean, that's the main thing. I'm tired and you're weak. Yeah, for 15 hours after surgery, I'm not doing too bad.
So the first thing you'll see that Mike is hooked to the oxygen, all right, and that's just given low flow oxygen. And as he starts waking up more and usually deep breathing, then that usually can come off, okay? And this right here on his finger is where we're monitoring his oxygen saturation.
Okay. And this is the heart monitor to measure your heart rate and the rhythm.
He's also hooked to the EKG, so we're monitoring his heart rate and his breathing rate. If Mike lets you know at any point in time that his heart feels like it's racing, just let us know, and he can be given medication and we can take care of that, okay? All right. And then also, right on that side, you'll see that Mike has a Foley bag in.
Yes.
Okay, and that's to drain his urine, okay? There's a catheter in his bladder. And as he, again, wakes up, starts moving, that catheter will be removed, and then we'll encourage him to start drinking.
Okay.
And he should have no problems going to the bathroom. On occasion, older men, sometimes they feel like their bladder is full, but they're not able to go. They have urinary retention. If that happens, just, again, let the nursing staff know, and we can give them some medication to help with that.
Okay, great.
Okay. The other thing that you'll see right down there is the chest tube. Okay, and that is draining the fluid from around his lungs, okay, where he had the operation, as well as your surgeon taught you a little bit about an air leak. The air is also coming out of that same tube. All right, and once that drainage decreases and his lung expands and he has no further air leak, then we'll also have that chest tube removed.
Blood clots can occur because of lying still, during, and after surgery.
It takes a little bit of time, and then these go on your legs.
You will have special stockings placed on your legs right before your operation to prevent blood clots.
When you're not moving, it's important to have those on your legs.
Medications may also be given to prevent clots.
Mike, I'm here to give you your heparin. And that's a medication that decreases the risk of you getting any blood clots.
Sometimes these are given in the abdomen and may cause black and blue spots to appear on the belly. Don't be alarmed if this happens. It is common.
So let me...
We're gonna try to walk down to the end of this hall here, okay?
Getting up and walking as often as possible, like 3 to 4 times a day, will also help.
We'll put this back on.
After surgery, your team will monitor you for any signs of pneumonia, which is an infection in your lungs.
You'll also notice that we have Mike sitting upright. We talked a lot about preventing pneumonia while he's here in the hospital. So the head of the bed is usually kept up at least 30 degrees, all right? And then he has his incentive spirometer there, which I know he was using beforehand, right? And while he's awake, we're gonna encourage him to keep using that like every hour while he's awake. And then I also see that you have his toothbrush and toothpaste and mouthwash here. And you're right, we want to try and decrease the bacteria that's in his mouth. And so just having him brush his teeth, clean out his mouth twice a day is a good thing as well. Walking 3 times a day.
After surgery, you may become confused. The confusion can range from mild memory loss and anxiety to fear, hallucinations, and on occasions combative behavior. Sometimes the behavior can be worse at night.
Should such symptoms occur, the understandings of family and friends is invaluable. Those close to you are encouraged to work with the healthcare team to provide you with a calm, familiar, and reassuring environment.
Throughout the entire time, starting with your first clinic visit, your healthcare team has been working to prepare you and your family for your return home from the hospital.
I've looked at your chest x-ray and everything looks great. So we'll be able to get you home today without any problems.
Now you've reached the day when it is time to return to the welcome and familiar comforts of home.
You ready to go home?
Sure, I'm ready to go home.
All right, I'm just gonna go over all of your discharge instructions with you.
It is so important you and your family ask any and all questions as they come up throughout the process. If you're not absolutely certain about home medications or doses, ask us to verify them. By this time, staff from social services will have arranged for home nursing or for a recuperative stay in a rehab facility, as well as physical therapy, oxygen, and other equipment your healthcare team deems necessary. Follow-up arrangements to see your surgeon will also be made for you. Your surgeon will communicate with all of your other physicians, including your primary care physician, to update them on your surgery and the course of your hospital treatment and stay. At home, you should continue to remain active. Walk 5 to 6 times a day. Use your incentive spirometer and flutter valve at least 4 or 5 times a day.
Continue to gradually increase your activity over the next few weeks. It's common to be tired in the afternoon after having been up and active in the morning. You may find a nap or rest in the early afternoon to be helpful.
Take your medications as instructed when you were sent home from the hospital.
Okay.
Confirm your follow-up appointment with your surgeon if you were not given a date and time when you were discharged. You were given a prescription for pain medication pills upon discharge. You'll want to have this filled right away. If you think you'll need a refill prior to an upcoming weekend or holiday, please call the contact number provided by your doctor. Once you're home, you shouldn't lift anything weighing more than 10 pounds until you've been seen by your surgeon and cleared to do so. Continue the stretching exercises you learned in the hospital. You may have drainage from your chest tube incisions. This is normal. Please call if this drainage continues and has an unpleasant odor. Clear fluid, however, is usually okay.
You may have to do dressing changes while you are at home.
And so I know you already washed your hands because that's the first step. And so here's the gauze that you can use, and we'll send you home with some as well as some tape. And the key thing when you put this on is just that you don't handle it with your fingers, the section that's going to be on. So there's a couple ways you can do that. You can either take a piece of tape like this, stick it right on the gauze, and then lift this up. And then the other way is for you to just take the ends, the 2 ends like this, and then put this clean part right on his wound site.
Most likely, you'll have sutures at the side of these chest tubes that your surgeon will remove at your first post-operative visit.
The big question is, how soon can I take a bath or shower?
That's a good question. You can take a shower 2 days after your chest tube is taken out. We leave that dressing over the chest tube site for 48 hours, and then you're allowed to shower. Bathing, you cannot do until you're cleared by your surgeon. That'll be after your follow-up appointment because we want to make sure that that skin glue over your incision is completely healed and that that chest tube site is completely sealed up as well.
As you're going to heal here, you will maybe notice that you get some sensations that go from your back all the way around to your chest. It can even include the breast area. You can have a full thickness burning type of sensation, a numbness tingling type of sensation. That's not unusual. That is from the surgery you've had.
Pain, burning, numbness, or tingling sensation in the upper back, shoulder, under the breast, or in the abdomen are commonly reported.
Don't be alarmed by that. That is normal. It will improve as you get several weeks out from surgery, okay?
If you do not have a history of bleeding ulcers and can take an over-the-counter pain medication, at the direction of your doctor, you may find it helpful to add 600 milligrams of ibuprofen every 8 hours to your pain medication regimen.
How soon after surgery should you have a bowel movement? I haven't had one for a while.
The anesthesia combined with the pain medicine can constipate a lot of people. So we want you to have a bowel movement about 48 hours after surgery.
Take milk of magnesia, magnesium citrate, or a laxative of your choice, according to the package directions. Colace is an additional medicine that your doctor may suggest to reduce constipation. Some patients have a frequent cough.
Get your attention real quick.
If you experience this, you may find taking a cough suppressant will help. Of course, it's critical that you follow your doctor's instructions.
Do you feel like you're ready to go back to work?
I think so.
You should call your doctor if pain not relieved by your medication, fever greater than 101, signs of wound infection, shortness of breath or painful breathing, worsening pain or swelling in the ankle or leg, continuous nausea and vomiting, coughing unrelieved by cough medicine or coughing up bright red blood, painful urination or foul-smelling urine. Call 911 or go to your local emergency room if you have sudden sharp pain, shortness of breath and feeling like your heart is racing, continuous coughing or bright red blood, sudden numbness or weakness in your arms or legs, sudden severe headaches, fainting spells.
If you have any questions or concerns after you return home, please contact your surgeon's office.
Ask questions. The more information you get beforehand, the better off you're going to be.
I appreciate everything you've done for me.
We hope that you found this video informative and that you now feel better prepared for your experience ahead. We hope you'll share this information with members of your family and friends as well, because they can benefit from this clarification of the processes involved in your procedure.
It was all a new experience for me, but the best advice I give is to be positive and relax and let your doctor take care of you.
On behalf of your healthcare team, we'd like to wish you a speedy and successful recovery.